Hello, hello, and welcome.
Welcome back to BWAC, Brain Injury Erotica for podcast,
Yes.
episode number 11.
11. See, I'd run out of fingers, so I couldn't remember which one it was. Well, that's my excuse.
Yes, cold, isn't it?
Yeah.
That's why you run out of fingers. They're in your
That's
little
it.
mittens.
Yes.
So, how are you?
Not too bad. Things have slowed down a bit, so which is good. Yeah.
Yeah,
You?
I'm alright, thank you.
Good.
Yeah,
Good.
cold,
Yes.
but I'm also happy because I've got chocolate cake next door, haven't we?
I'm drinking chocolate today.
I'm drinking chocolate
A
today.
one-off.
Yes.
Or first time off. Something like that.
May become a new routine, who knows,
Yes.
over winter.
Yes.
So, what did you want to talk about today?
Well, you'd asked me to have a think, and I think my thinking went off of the train somewhere because I couldn't. And then I thought, well, maybe I know we've spoken about it, but a bit about the heart surgery because it was actually quite a traumatic time for both of us. And I think it'd be good if we had a little, slightly deeper dive into that.
A bit more of a recap. So I found some photographs of when you were in hospital, didn't I?
God, yes, you did.
The other day, which we obviously haven't looked at for
Since then, really.
Yeah. So what came to mind when you were looking at your photos? Do you remember much about the time?
I have flashes of memory of different bits of time, and but I think most of the time I was out of it. I think because of drugs and whatever have you, or maybe I wasn't. I don't know.
Are you talking about in Liverpool itself now? Yeah. There's that one photo of you when I came to visit you in the General Hospital before you went to Liverpool and snuck you off down to the canteen.
Oh yes.
And you just looked thoroughly depressed on the picture, didn't
you? I must admit to having a little cry several times when I was, because I'm not going to say depressed. My mood was low, because it was, but I managed to pull myself out of it every time. But, especially when you walked in at visiting time.
Yeah, I think being in hospital, especially for a prolonged period of time, is really demoralising. And maybe people don't realise the effects that it has on a patient being in hospital for a prolonged period of time. Because, we come and visit.
Yeah.
So whatever that hour, 2 hours, whatever, you're there 24 hours, aren't you?
And then
there's nothing to do.
And your life carries on outside.
Yeah.
But I think it was me because I was a nurse already, ex-nurse, retired, whatever you want to call it. And I'd already spent hundreds of hours in a hospital type setting, and to be stuck in it all the time,
But complete role reversal though, because when you're working in a hospital, you've got your colleagues, you've got your jobs to do, you've got your tasks, you're busy, and you can leave.
Yeah. And I think there was lots. It was funny, especially I noticed among a lot of the men, they were actually enjoying being in hospital, being looked after. And I used to hear them, they'd be laughing and joking. Family'd come in and they'd go, "Oh, I'm no better. Oh, pain." I thought, is that the same bloke in the same bed? Then after they'd gone, it was the same bloke in the same bed. So then the chocolate eater in the next bed to me, he was about 10 o'clock at night. Shut me curtains round and I'd hear a rustling. And then I'd hear paper. And that could go on for 45 minutes. He used to carry a bag full. He used to get through every night. I mean...
Were you jealous because you didn't have any?
No, I used to have one. That was enough. That's what I just needed. One. But it was the noise. It was all the noise.
Noise in hospital is horrendous.
Yeah,
I mean, I haven't worked in art shift for a long time, but now with the amount of machinery there is and blood pressure machines bleep,
beeps.
The IV machines bleep. Nobody's quiet. I really don't think anybody sleeps well in hospital anymore, which is obviously detrimental to your health. And no wonder a lot of elderly people get confused when they're in hospital because of all the whatever. But also, I mean, I know you were on the heart ward and you weren't allowed to exercise. But realistically, there is nothing to do in hospital, is there?
No.
So what were you doing to keep yourself, apart from people watching and harassing the staff to try and get you sent to Liverpool, what were you doing to pass your time?
Listen to podcasts. Because at that point, I still hadn't realised about audiobooks. I knew about audiobooks, but I hadn't realised there could be a tool to help me. So I buried myself in podcasts.
Yeah.
You know, because I don't have concentration for doing things like crosswords or none of that. Yeah. Bang my earphones on. Away I went.
Yeah. Good. So what else did the pictures bring up for you?
It made me think actually when we got to Liverpool. It was funny, they took... I had to go in an ambulance, apparently, because of my heart risk. So there was one driving, and then all the way to Liverpool, there was one sitting next to me on his phone, all the way there. You know, they never said a word, never talked to me, or, you know. Not that I'm bothered, but I think I would do better if it had been me. Yeah. And then they were okay when we got to Liverpool. Then I had to have the indignity of having every hair off my body. They gave you an electric razor.
Yeah.
Said, can you do it? They took me to the bathroom. Everything from the neck down.
Yeah.
Had to come off, every hair.
Every hair on your body.
It's quite an itchy experience. And then I was thinking about the day, which was the next day, wasn't it? I think.
So you, whatever day it was you got there, you were due for you had the surgery the next morning, you were first on.
And as I was going out, you know, and on the anaesthetic, I remember thinking, you know, don't worry if this is your last time for going off to sleep, because there's nothing you can do about it. You know, I was sad for what, but I thought there's no point, otherwise I'd have jumped up and ran out with my gown around me, showing me backside to everybody.
Yeah.
You know.
Yeah, because when they come to do the consent form with you, it said, didn't it, the number one risk was death, wasn't it, on the consent form? But ultimately, you would have. But
as I said, there was no other option.
No.
My heart was failing.
Yeah.
Got into heart failure. I didn't have much choice, you know. It was my kind of win on the lottery.
Yeah. Yeah.
Really.
Yeah. I must admit, actually, it never even occurred to me that you wouldn't come through the surgery.
No, it didn't me.
Until I went, because I was in the relatives' accommodation, wasn't I? And somebody said there that they'd been there for a while with their relative, and that the week before somebody had been admitted as an emergency and didn't make it through the surgery. And that was the first time I thought, oh, maybe there's a risk. You know, maybe there is a risk even though it was the number one potential issue from the surgery. And also they'd said that they would ring me when you got to ITU and nobody rang me. So I think you'd been in ITU about 3 hours by the time I actually got over to you. So I was a bit worried then because I was thinking, why is it taking so long? Why is it taking so long? But actually, when I walked into ITU, you were only asleep for about 30 seconds before you sort of opened your eyes as I came in the door, which was good.
But I had no sense of time, and it was a massive room.
Yeah.
And it looked circular, and it looked like there was like about 20 odd beds.
I think at least 20 beds
going round, everyone having had surgery on that day, which was quite amazing.
Yeah, I think not necessarily all on the same day, but certainly like in the last 24 hours sort of thing. Or because there was a man up on the ward who came up after you, and I think he'd had his surgery the day before, but he was in intensive care for a few days, whereas you were in intensive care for like less than 24 hours.
Yeah, because I didn't like it. I remember sort of waking up, and I couldn't. My eyes weren't working. Everything was like double vision. And the sister, I think she was came in. They said, it's only the anaesthetic wearing off. So I had this Spanish guy who was the nurse looking after me, who was obviously very confident, but not much of a bedside manner. No smiles, nothing. He hardly said a word to me. And I asked for a drink, and he put it out my reach, walked off. And I thought, it was little things like that. It was, I had a catheter in, I remember that, which I was glad because that meant I wasn't bursting for a week.
You didn't want to move anyway.
I couldn't have got out of bed.
So it was when I came into intensive care, it was actually a lady looking after you.
Swapped.
And I remember, I don't know if you remember this at all, because you were still intubated at the time, so you still had the tube down your throat. And she was doing some blood tests and checking things before she could take it out. And you were doing this, making a wind it up motion, like take it out, hurry up, take it out. And she was saying to you, just going to do this for you now, Bob, and explaining things. Do you remember it?
Vaguely. Yeah. No, you've said it. Yes.
Like hurry up. Yeah. And then that tube came out. So you responded really well post surgery to everything, which is
positive. Good. You see,
yeah.
Positive.
Do you remember the little purple spots you were seeing?
Yes, that was part of the anaesthetic. They said, so I couldn't see the clock because that was right. It was opposite me, but it was the other side of the ITU, and I had no clue what time of day it was. I didn't know if I'd been there all night. If it was the same day, it was all. And I remember I had all these tubes
out your neck,
from both sides, where they'd been inflate my chest and taking blood. And God knows, yeah. And I had these, what they call TED stockings.
Yeah.
They were on, they were comfortable and uncomfortable at the same time. I don't know how they managed it.
It still makes me shiver, actually. I've never been a squeamish person, but looking back at the photos of that wound on your leg, because it was from your groin to your ankle, wasn't it?
Yeah.
And it makes me shudder.
In a long straight line.
Yeah.
But funnily enough, the pain used to alternate between my leg and my chest, depending on how I moved.
Yeah.
So I remember they used to give me like these long plasters on my chest with local anaesthetic and across the scar, which used to help. And the famous towel. Remember they give me a rolled up towel. And that was for if I needed to cough. I used to have to pin it. If I felt a cough coming on, sneeze, anything like that, I had to grab it and hold it tight to my chest so it would absorb the...
And for moving, for sitting up and moving on the bed, for anything else.
On in the car with a seatbelt. Yeah. And then there was the night of the Japanese invasion. Do you remember that? Well, you don't. I do.
I remember it because it broke me and I left you to it. I have to be honest. So, from a carer's point of view, I'd booked into the relatives accommodation, but actually I ended up staying on the ward with you, didn't I?
Most of the time.
I had a camp bed on the ward, so I didn't really have much sleep myself. So it was fine. I was happy to be there. But by the time, the Japanese came, so you, just to recap, you were given, you weren't given regular pain relief. And it was a bit of a battle because we didn't see the same doctors.
And I got a feeling that they didn't like giving any drugs because they had lots of druggies who came in as patients.
Definitely seemed to be that they were accusing you. Well, that one doctor did definitely accuse you of being drug seeking.
Yeah.
Because I was afraid that you'd had an extension of your stroke because you wouldn't speak. But also, I remember this.
I was sulking.
No, because I said to you, "Are you hallucinating?" And you just sort of looked at me, little twinkle in your eye, and smiled and didn't say a word. So I thought, but the doctor had said they didn't want to give you morphine and they wanted you to have tramadol. And I said, I don't want you to have tramadol because like a third of people who take tramadol hallucinate with it. And I just knew you'd be one of them because you're quite sensitive to meds, aren't you?
But they give it me anyway.
So that was the only thing they were going to give you. So it was a case of, well, have that or nothing. So you were hallucinating away, lovely, and trying to escape out of bed, bearing in mind that you'd got...
It's not house surgery.
Yeah.
Dressings all down my legs. But what I don't dare say what it was like. It was like I was looking through they have these big tall plants in the jungle. So I was looking through them and I could see like outlines of Japanese huts and they were looking for me. And I was just trying to, but at the same time I knew that I was hallucinating. It's a weird, I believe both sets of input were true to me at that time. So that was the night I wriggled down the bed. So I wriggled down and I got one leg off the bottom of my bed, I think. It took me ages. And then the nurse came in and said, "What's happened to you?" What did I say? I slept. That was it, I slept. So they got another two nurses, they put me back. And I think fortunately by then the medication was starting to wear off. Yeah.
And you'd already tried to escape the bed about 3 times while I was there, which is why I just said, I can't do this and I'm going because I'd had no sleep. But I left the ward in tears. Yeah, do you remember that?
Yeah. But the need to get out and find you was my overriding.
It wasn't the need to get out and find me because I was there when you were trying to get out and escape. The first 3 times you tried to get out of bed.
My mother then.
Yes.
Yeah. Yes. Get the taxi.
Get the taxi and let's go.
Yeah.
But I think in that case, it was a good job that you had previously had your strokes because you couldn't literally get out of bed because of So there, yay, benefit from having weakness one side and the opposite leg cut to ribbons. Yeah.
So then they decided perhaps I could have some proper.
Yes.
And they said only till discharge.
Yeah.
I said that's all I need it for. I don't need any more.
And then they sent you home with like a month's worth of morphine.
Yeah.
Long and short acting morphine tablets.
Which I'd like to point out, I never completed the course.
No.
Because I switched to a lower a lower status.
Yeah, it was all a bit bizarre, really, wasn't it? Having said
Yeah.
that, though, the staff were lovely.
They were.
Most of them. As in most places, the staff are never always
Yeah.
100%, are they? But
They were nice, though.
they were.
Yeah.
And we did buy them chocolates to them.
Yes,
but
we did.
and no disrespect whatsoever, we were incredibly grateful for what they'd done, but we wanted to come home.
Yes.
And it was, it's an hour and a half drive
Yeah.
from Liverpool, and I think we didn't really consider how things would be, particularly once we got you home. But
No.
I got you a chair, and got
And
that
they,
all set up. But,
yeah.
But the drive home was
quite hard
difficult for
because
you.
of bumps and.
Yeah.
But I said, I don't care. Just get me home.
Yeah.
And then you plunked me from the telly and they went, oh, thank God.
Yeah, I think you slept in the chair for about 3 nights. You couldn't lie on the bed, could you?
No, I couldn't lie down. Couldn't get onto the bed.
Yeah.
It was a recliner, so you just had to recline it. I didn't have to move. only with the chair. And then after a few nights, I managed to get into bed. But then I had to sleep sitting up, didn't I? Because I couldn't lie down. So it all took a while. Then every night I tried to sit down until the one night I thought, oh, yes, I'm in position.
You were able to lie on your side, get into bed, lie down and go onto your side.
Yeah.
Yeah.
But I still, how many years on is it?
8.
8. I still get in bed the same way. And it's not easy to be explained, so I won't tell you, but I have to climb onto the bed on my hands and knees to lie down. But it's still how I do it because it works for me. Yeah.
So you're not going to tell them, but you told them?
Didn't fully explain. I could have been going hands and knees across the ceiling. Well, they know.
Yeah.
Yes. So that's, yeah. Yeah, I don't think I've anything else to say.
I don't know. Have you got anything else to say?
No, I had my pillow for quite a while. No, I didn't. My towel.
Your towel.
I took that everywhere with me. In the car, out and about, just in case I coughed.
Yeah.
Yeah.
I think from the point of view of recovery after your heart surgery, it was a lot longer than somebody who hadn't had stroke prior. I think the surgeon, when we went to have your outpatient appointment after, he was like, why aren't you walking? Why aren't you, and I mean, you could walk, you couldn't walk far, but then you couldn't walk far anyway because of your stroke. And we sort of said, well, he has had 2 strokes and he is anemic. So they sent you home, you were quite anemic.
Yeah. And had fluid on the lungs, which I didn't know about.
Yeah. Yeah.
Which also affected my breathing.
Yeah. So I think,
But the second doctor we saw, the one who discharged me, said, you're good for another 20 or 30 years now. And I said, I'll take the 30. Thank you very much. And he started laughing.
Yeah. So, did you ever think about your recovery as being anything other than what it was like? Did you get frustrated that you weren't able to do things more quickly, or
no,
day to day like you are now, really?
Yeah, I think it was more. I did what I could to get on with it. That was the. I think, to be honest, that was most of the time I was hurting so much that I didn't have time. Didn't have time to think, oh, I should be doing better than this, or I'm doing too much.
You did complete the exercise and things at the cardiac rehab that they sent you to, and that, didn't you? And we covered that you did go to the gym after on that exercise by invitation thing. But as you say, to go into the gym for your 10-15 minutes exercise. And it
And
was
that's
2 hours.
an hour there, an hour
an hour there
back.
and back. Yeah.
And I'd be exhausted. Yeah.
So
Yes.
there we are. So do you feel like you've recapped and you?
Yes, I've got that off my chest, so to
Good.
speak.
Good. Because
Yes.
I've noticed since we've been doing the podcast that things will crop up that you would probably never talk to me about, but it might be there a little bit in your head for a while.
It kind of pops in and out.
Yeah. So this has been quite therapeutic in that way, hasn't
Quite
it?
cathartic.
Gives you a little half an hour a week to.
And for Graham, if you're listening, wait till you see the pictures. Hope you got a strong stomach. That's all I'll say.
And I didn't even take all the pictures of all the tubes.
No.
You'll be thankful to know I didn't take a photograph of the cat.
I didn't even feel to take it out. Did it while I was
fast asleep.
Yeah,
thankfully.
Yeah.
Well, on that toilet humour note, shall we wrap it up for this week?
Yes. And it may or may not be more exciting next week. Who knows? We haven't decided yet.
Yeah, we'll see what you want to talk about next week.
Yes.
And what happens this week.
Okay.
All right.
Yes.
So say goodbye to everybody.
As I was spend time in Liverpool. Tatty bye, everybody.
Tatty bye. See you next time. Bye bye.